you've just been diagnosed with diabetes, so we're going to go ahead and try to get you that meter. Monitoring is the one tool that the patient has to really see if they're doing okay or not doing okay. The meter is one of the best tools that you have to check your blood sugar and your progress and to see how your diabetes is doing. 80 to 120 is pretty close to the normal range before a meal. Usually by 2 hours after a meal, we want their blood sugars to be between 80 and 140. And then before they go to bed, we want to keep them around 80 to 140 so that they're not going to be eating for about 8 hours during the time that they sleep. So we don't want them to run the risk of a low blood sugar reaction during the night. If someone is on insulin, they should be testing their blood sugars at least 3 times a day. And the times that we ask people to test vary. Usually it's before meals and bedtime. And now we've added the 2 hours after a meal. By testing more frequently, we get a little bit better idea of what a patient's blood sugar really is doing throughout the day. This is the lancing device. What you're going to do is fit your lancet inside tightly. The new meters now take a much smaller amount of blood than the meters in the past did. And what that means for you is that you have to stick yourself a little bit less hard in order to get enough blood to get a good sample. Once your lancet is loaded, it's usually cocked and ready to go. And this is your trigger. Have you put the strip in the meter? Want them to be able to see success. I took this walk, my blood sugar was 200, now it's 150 or 160.
Push that right there, and
make sure that it's up against your finger with good pressure.
Like that?
Yeah, just like that. Perfect. Our job is to try to convince them that it's very important that they try to take care of their diabetes.
Since I've been here like a couple hours, is that going to be, would that be normal then, or is that like to have that sort of change?
You're in control. It's very normal. Your blood sugar changes every few minutes. And that taking care of their diabetes early can make a big difference in their lives down the road. Blood sugar's great, 118.